All right, I think I'm being recorded. Awesome. Hello, everyone. My name is Emily Krause. I am a sports medicine physician at Stanford Children's Orthopedics and Sports Medicine Center. I have a particular interest and passion in endurance medicine as well, endurance sports medicine, hence why I am studying ultramarathoners. So the title of the study is genetic and environmental predictors of low bone mineral density and bone stress injury in ultramarathon runners. I want to start off by giving a very big thank you to Western States Research Foundation for funding this study, as well as the stellar research team who, without them, this study would not have been able to take place. So the purpose of this study was to explore risk factors for low bone mineral density and prior bone stress injury in male and female ultramarathon runners. To provide a little background, bone stress injuries represent the inability of a bone to withstand stress from repetitive submaximal loading. This is also referred to as stress fractures and stress reactions. Research has shown that distance runners are at highest risk, with the yearly incidence of bone stress injury among track and field athletes around 21%, and lifetime history in female ultramarathon runners around 21% as well. Bone stress injuries kind of encompass a full spectrum of the injury, starting with just a small amount of periosteal or bone marrow edema, which then can progress and worsen to a full-on fracture line. And that can really dictate how severe the injury is and the duration of rest and recovery. So research has shown that there has been a genetic link to bone mineral density. However, the extent to that linkage is still less understood. So Dr. Stuart Kim back in 2018 identified 22,000 single nucleotide polymorphisms out of the UK Biobank and found that these were predictors of healed bone mineral density. He took that UK genetic algorithm and combined it with height, weight, age, and sex to come up with the bone mineral density osteoporosis genetic risk score, also referred to as the BOG. He found that the BOG has been found to have the best correlation with bone mineral density. However, it has not been tested in any athlete population, let alone ultramarathoners. To provide a little bit more background, I want to define the female athlete triad. Female athlete triad is comprised of 3 interrelated components: low energy availability with or without disordered eating, osteoporosis or low bone mineral density, and functional hypothalamic amenorrhea or menstrual irregularities. So back in 2014, a group of experts met and came up with a female athlete triad coalition consensus statement. And then through that, they established this cumulative risk assessment tool, which took these female athlete triad risk factors and broke them down and scored them, assigned points to them. And through this, a clinician could identify an athlete as low, moderate, or high risk. Further research has identified an equivalent in males, and this cumulative risk assessment tool has been applied to males, of course, just eliminating the menstrual questions from it. So research on the cumulative risk assessment tool has shown that these scores can predict future bone stress injury in females, with each additional point increasing risk by 13%. Studies have also shown that each 1-point increase in cumulative risk assessment score was associated with a 37% increase in prospective bone stress injury risk in males. However, studies are extremely limited in the ultramarathon population, specifically exploring these bone stress injury risk factors. Hence why we were compelled to do this study. This is a cross-sectional study on male and female ultramarathoners racing in the 100-mile endurance race, the Western States endurance race, in 2018 and 2019. The study was approved by the Stanford IRB in 2019 and the UC Davis IRB in 2018. So each participant was consented and conducted a pre-race survey asking questions on disordered eating, bone stress injury history, menstrual history in females, and overall training volume. Each athlete then underwent genetic testing, specifically a saliva test through Axgen Sports Genetics. Athletes underwent DEXA scan testing, looking at bone mineral density of lumbar spine, femoral neck, and total hip. This was done through body spec. All these assessments were done on site the 2 days leading up to the race. Finally, athletes underwent lab draw, fasting lab draw, looking at estradiol, total, and free testosterone through Inside Tracker, which is a sports performance serologic or lab testing agency. So a little bit more on our statistical analysis. Our primary analysis was primarily descriptive. We looked at the prevalence of triad risk factors in ultramarathon runners. Then our secondary analysis explored associations between these triad risk factors with bone stress injury and bone mineral density, looking at individual and cumulative triad risk scores based on that table that I provided earlier, the genetic risk score, the BOG, and serum hormone levels. And you can see our statistical analysis below. So diving into the results, here are our descriptive variables. We studied 40 women and 83 men. Now this ratio was pretty consistent with the ratio of the participants who actually raced in Western states. We captured about 20% of the participants in 2018 and also around 20% in 2019. Demographics were pretty similar regarding age, BMI, mileage, as you can see that here. Looking at specific risk factors, such as bone stress injury risk, we found that 41% of females and 22% of males reported at least one prior bone stress injury. You can see that here. And then regarding bone mineral density, we found that 17% of females and 33% of males had a Z-score, a bone mineral density Z-score of less than -1, which per definition, based on the American Medical Society of Sports Medicine, is defined as low bone mineral density for an athlete. In males, we found that higher serum free testosterone correlated with higher hip bone mineral density and femur bone mineral density Z-scores. And we found that the genetic risk score significantly correlated with bone mineral density Z-scores of the lumbar spine, total hip, femoral neck, forearm, and total body. In females, we found that higher estradiol correlated with higher spine bone mineral density, and that the correlations between genetic risk score and bone mineral density were 0 or negative at all bone sites. So in conclusion, we found that the BMD, bone mineral density genetic risk score, was significantly correlated with BMD in the male but not female ultramarathon runners. We found that higher levels of sex hormones were correlated with higher bone mineral density in both sexes. This is really the first study to investigate the prevalence of risk factors for bone stress injury and low bone mineral density in male and female ultramarathon runners. Some of the limitations in our study include that this is a small sample size, including specifically in females, looking at the genetic risk score. It was surprising that there was not a correlation between genetic risk in female athletes, and we do question whether there may be more environmental, nutritional, and hormonal factors that can be contributing that could kind of balance out that genetic risk, which is a really interesting question. All the data from the survey was self-reported, including injury history, nutritional history, disordered eating history, so that can be sometimes skewed. And then this is a more heterogeneous population compared to other running groups studied regarding age and BMI and just overall training volume, so we have to take that into account as well. For acknowledgements, a big thank you again to Western States Research Foundation for funding this study 2 years in a row. We hope to continue the study, of course not this year, it is canceled due to coronavirus, but ideally in 2021. Big thank you to AMSSM for allowing me to still share this research and present in the comfort of my dark living room. Our ultramarathon volunteer participants, our statistician, Kristen Sinani, our cellular research team, big thank you again to you guys. And then our partnering vendors, Axogen Sports Genetics, Inside Tracker, Sports Performance, lab testing, and Body Spec Mobile DEXA Scan. All of them did an amazing job. They were very communicative and wonderful to work with. That's the conclusion of my talk. Of course, I can't answer any questions right now, but if you do have questions, you can really shoot me an email, or I can find a way to allow communication to allow questions to be answered. Thank you very much and have a wonderful day.